Hi, my name is Jennifer, and I did my presentation on Dr. Gina Green. So a little bit of background on Dr. Green. She received her doctoral degree from Utah State University in 1986. She is a prominent researcher, especially with young children who have autism. She's also an advocate for training behavior analysts and licensing behavior analysts, and also she's an advocate for public policies regarding ABA. In addition to these accomplishments, she also has earned several honors and awards for her contributions to the ABA field, and she's held several prominent positions in the field of ABA, including being president of the ABAI and being on the board of directors for the APBA and the BACB. Of the many articles I read, several of them dealt on Dr. Green's work with students or learners with autism, and so I'm going to talk about a couple of those articles. The first article was about 3 considerations when starting intervention when a learner has been diagnosed with autism. And the 3 considerations that Dr. Green and her colleague talked about were to know the learner's current level of functioning, their strengths, and their weaknesses. And by knowing these things, you're able to create a target intervention for them that's appropriate. And then you can also break down tasks for them, knowing that target intervention, what that is, that target objective. They also talked about by knowing the level of functioning, the strengths and the weaknesses, then you're also more able to provide a safe and a secure independent for the learner, as well as enabling the learner to work a little more independently. The second article I read on stimulus control technology, it was called Behavior Analytic Instruction for Learners with Autism, Advances in Stimulus Control Technology. Dr. Green writes about stimulus control techniques, prompt fading techniques, and incidental teaching procedures. So for the sake of time, I'm just going to focus on the matching to sample procedure that she wrote about. The first thing she was talking about was that discrimination and matching skills kind of go hand in hand, and that simple discrimination has 3 contingencies to go along with it, and that is that you need to have an antecedent, stimulus, a response, and a consequence. Whereas with a conditional discrimination, you also need to have that conditional stimulus to go along with that. For the matching to sample procedures, Dr. Green said that pretty much anything that you can do with your 5 senses can be done through an MTS procedure. And she gives 9 guidelines for explicitly teaching MTS procedures, so I'm just going to run through those briefly. The first thing is she says a different sample should be presented on each trial, but the same comparisons should appear in every trial. The second thing she says is that at least 3 comparisons should be in every trial, and that within a session, each sample should be presented equally often. The position of the conditional stimulus should vary from trial to trial. The learners should be required to make an observing response to the sample stimulus on each trial, so just making sure they know what they're looking at. If the sample stimuli are auditory, they should be presented clearly to start the trial. You should prepare the comparison array on a mat or a board out of the learner's sight, so that way you can not be influencing them in any way. And then you want to teach learners how to perform the MTS task before trying to teach them a new conditional discrimination. And you want to use errorless teaching methods rather than trial and error to teach your discrimination. The other focus of hers was on licensing behavior analysts and having those analysts evaluate interventions. So the first article I read, Dr. Green and her colleague Dr. Johnson talked about funding sources being reluctant to pay people who are not licensed. So that would be one reason that licensure as for analysts as a field on their own, as opposed to being licensed within another medical profession, would be a benefit. Additionally, it would differentiate practitioners, so those who are licensed versus those who are not licensed, those consumers and employers have a have something to look at to see whether they want to choose somebody who's licensed or somebody who's not. And then by being licensed, that assures more of a chance of making a living for the analysts themselves. To go along with that, to get licensed, there are a lot of needs, and so money, of course, is one of them. If it's going to be a national issue, then you would need lobbyists with a proposed language. So they suggested having already had the bill written for those lobbyists to make it easier. And then, of course, you want to have enough practitioners to warrant that statute. If you only have a few, she talks about how the lobbyists and lawmakers are going to be less likely to want to license individuals. In the second article that I read, there also were talking about the risk to licensing, and one of the biggest risks that they talked about was if you're licensed in one state, then if you moved to another state, you might not be able to practice right away or for a while just because their licensing procedures could be different from the state you moved from, and so you would have to get relicensed. And lastly, the last article I'm going to focus on was about evaluating interventions, and especially the evidence for intervention. So if you're going to use an intervention as an applied behavior analyst, making sure, Dr. Green is talking about making sure that you know the benefits and the side effects of the intervention that you're going to use, and that you want to also be able to differentiate for the consumer what's effective and what is not effective. And so she suggests 5 guidelines or for competencies for practitioners, and one of them is to have skepticism as a worldview. So just to be skeptical of everything that's out there and really do your homework as far as making sure you know why these interventions are being touted, if they are being touted as effective way. To know the characteristics of science and follow the scientific method. To know how thinking goes wrong, and to go along with that then those pseudosciences or junk sciences, to know how they're different from science and why people believe them and how they can cause harm. And so additionally, if as an analyst you see this claim that this intervention works, she suggests knowing or going through and making sure that you've seen that the intervention has followed the scientific method and their controlled experiment, that there were independent and dependent variables, that there's evidence of the effect and that it can be replicated. You also want to check for generality, that it's been peer reviewed, and that the importance of that intervention is talked about not only for ABA but for any area where that intervention might be effective. That was my presentation on Dr. Green. Thank you for listening.